how do you think nursing will address the ongoing long-term impact of COVID as it's kind of gone from a pandemic to more of an endemic situation? What are your thoughts?
I think people will still be on the cautionary side. I mean, even here in New York City, even though regulations are changing, there are still a lot of what ifs, right? Plus, of course, we need to continue to watch out for the variants. We just have the Omicron, and then there's one that's also coming up. So from a public health perspective, I think it's good for us to be cautious in trying to monitor and also just follow the science. I know there's a lot of hesitancy in terms of the vaccination, but we can see the trend when the uptake of vaccines increased and when COVID-19 also sort of like decreased. So we just need to continue to be vigilant and at the same time protect ourselves, follow the infection prevention control guidelines. I know it's harder for nurses, especially for Filipino American nurses, right? Because we were so disproportionately affected by COVID-19. And the impact to everyone will stay. In fact, I was in one of our hospitals today, and there was a wall capturing faces of nurses and healthcare workers, and even a person that was a garage assistant who passed away because of COVID. And one of the conversations that we have is that they will probably put these names and pictures of individuals inside the chapel so people can always remember what happened during the height of the pandemic. And I think we're so lucky that we were able to capture these stories, right? In spite of what's going on, there's always that silver lining in terms of moving forward and honoring our nurses who really was really and it's really emotional for me just trying to think it through. Honoring our nurses who really fought through during the pandemic. And I hope that the public will continue to remember that, even though we have faced into an endemic stage at this time, and continue to have that respect for our healthcare profession.
Definitely. The wall project that you mentioned seemed really beautiful. And it's really beautiful to be able to capture all the stories during COVID. And as a leader, how are you dealing with this ongoing COVID crisis and addressing nursing capacity, burnout, and retention?
PNAA is still continuing with our Kabalikat program. If you remember, we started with our Heal Our Nurses campaign. And through that Heal Our Nurses campaign, I know that there's going to be ongoing support needed, especially in supporting our nurses' resilience and well-being. So we did the emotions behind the mask survey. We did the resilience training program through Dr. Amit Sood, and our practice committee have facilitated the Kabalikat program, which is a peer-to-peer support program. And the next step that the committee is going to do is to conduct another survey to see where is everyone at and how can we continue to support each other, not just from a personal level, but also developing our organizational resilience. So this way we can provide the adequate support for the long haul.